Good morning, afternoon, evening to everyone. Certainly evening here in Australia. And thanks very much for your interest in the topic. I realise that many of you have experience with Photovoice and other visual methodologies, so I'm really looking forward to the discussion at the end of the presentation today. I'd also like to thank the members of Strive for asking me to talk today, especially Annie Holmes and Liz Christian, who's been very helpful and patient. So I thought what I'd do today is very briefly, I'll move quite quickly through the first few slides, introduce Photovoice and briefly outline what's involved with the method, and then particularly draw on a case study of work that I did in Papua New Guinea. So just to outline what Photovoice is, it's a methodology that was developed by Caroline Wang and Marianne Burris and colleagues working in southern China. They were working with rural women in southern China in the mid-90s. And they developed a tool that was very much based on a Freudian approach, and they would describe Photovoice as a process by which people can identify, represent and enhance their community through photography. So the method is aiming to enable people to record and reflect their community's strengths but also concerns, and to promote dialogue and sharing of knowledge between policymakers and amongst participants through group discussions and community exhibitions. And those community exhibitions are primarily to try and reach policymakers and power brokers in communities. Photovoice involves training participants, whichever community group that you're working with, as photographers and also to act as co-researchers in the project. It involves the participants then going out and taking photographs. Now, in the case study I'll talk about, I asked people to take photographs of things that they thought had a positive influence on their health, as well as things that had a negative influence on their health. But you could shape the things that people take photographs of to suit your particular research questions, or leave it fairly open like I did. I was interested in health quite broadly, and that way by keeping it a broad question, you enable people to share what they think are the important things in their lives in relation to health. The method then involves working with participants to choose images that they think best illustrate the issues that they're trying to raise, or issues that they particularly want to talk about in small groups, or sometimes participants choose an image because they particularly like it, and of course that's totally legitimate as well. Participants then draft short text that could be just a caption to go with their photograph, or it might be an explanation or a short story that the participants write to illustrate the photograph or explain it further rather than just relying on the image. And I think that's quite important because sometimes it's possible for people to misinterpret or misunderstand photographs if they don't have any text accompanying them. Then the process involves working with participants in both small and large group discussion of the themes that are present in the images. So any recurrent topics that keep coming up through different participants' photographs, or sometimes it might be a theme that's particularly recurrent for an individual participant that they would really like to discuss with their peers in a group. Caroline Wang suggests a particular way of facilitating these group discussions around the mnemonic SHOWED, SHOWED, and that you'll find more about that in the literature, particularly in the Wang papers. But what she asks people is, well, what do you see here? What's really happening? How does this relate to our lives? Why does this situation or concern or strength exist? And then what can we do about that? And when I get to talking about the Papua New Guinea case study, I'll talk about some of the challenges we faced in using that particular approach to the participants analysing their own images. But it is one way of supporting discussion of the themes that are present. And then finally, the tool involves public exhibitions of images that are aimed at community leaders and decision makers. The theoretical basis of Photovoice really comes from three different traditions. Firstly, participant-driven documentary photography. So, for example, the work of Jim Hubbard, where he worked with young people to try and shoot back, is how he would describe it, through photography and using cameras. But also from feminist theory, so viewing research participants as actors in the world rather than just objects of study and recognising that. But also recognising the potential of knowledge making, so the active participation of research participants in co-constructing understanding about their lives, that can potentially empower participants to act, to change their circumstances. And then finally, as I've already mentioned, Paulo Freire, in particular drawing on his problem-posing approach to education. Freire always, his problem-posing approach started with the issues that people see as central to their lives, and he used to use line drawings to provoke conversations about the priorities that young people, or that people in the community that he was working with had. And those line drawings would represent sort of significant real-world problems. In some ways, Photovoice takes that a step further. Instead of the researcher providing line drawings and discussing those, it's based on the pictures that the participants themselves take. Freire, the method also draws on Freire's understanding of praxis. That's that cycle of action and reflection that many of you will be familiar with, and recognising that critical reflection can generate ideas that can be tested through action, and then that experience can generate more reflection and further action. So I guess to emphasise that the tool has built into it really, has a distinct intent towards action and or advocacy. Why you might use the approach? Well, originally it was developed for participatory needs assessment. That was how Wang was using it in China, to try and look at what rural women in Yunnan thought were their priority health needs, and therefore to build that into the design of projects. It was part of a big Ford Foundation funded initiative in Yunnan. But Photovoice is also commonly used in project evaluation and for advocacy around particular health issues. So some work that I'm involved in at the moment in the Philippines with women with disability, Photovoice there, we haven't actually started the Photovoice component of that project, but there we're going to look at using the method as a way of really trying to advocate, supporting disabled persons' organisations to advocate and share their experience of what it's like to live in Manila as a woman with disability. I think that's a big strength of the tool, is that it's able to elicit participants' lived experience and supports participants to communicate this through the rich language that you have access to when you're using both images and text. So the combination of images and text is a sort of bigger vocabulary, if you like, than just language on its own. And the method definitely, or certainly my experience of it has been that it emotionally engages both participants and the audience, and in particular images are emotionally engaging, and that I think has particular relevance in terms of engaging perhaps groups who may be harder to engage in research, like young people sometimes can be harder to have sustained participation in a research project. But it also is important to consider when thinking about the audience that if a policymaker or opinion leader is emotionally engaged in the issue that's being raised by a young person or a participant in their photograph, that they're perhaps more likely to enter into a discussion or dialogue with that participant about the issue. So to talk about that a little further, I thought I'd draw upon the Tok Piksa Project, which is a project that I was involved with in Papua New Guinea with 3 different groups of Papua New Guinean youth in the Highlands. This was work that I did as part of my PhD, which at this stage I really should acknowledge Cathy Campbell at the London School of Economics, who was my supervisor for that PhD project. And what I was looking at there was really came out of my background as a public health practitioner, I suppose. I've worked on and off for a number of years on youth-focused HIV projects in Papua New Guinea and elsewhere, and was starting to question some of the underlying assumptions that the projects I was involved in were based on, and therefore this really motivated me to kind of develop a research project with young people themselves, trying to get their perspectives around health and HIV to test some of the assumptions of program designers, for example. So the point of that research was to try and better understand how external actors, so that might be NGOs, in the case of Papua New Guinea churches, donor agencies, consultants and people like myself, but also external actors in terms of national NGOs and perhaps well-educated elites from the capital city, how they can better support young people to improve their health outcomes in the highlands of Papua New Guinea. And specifically, I wanted to see how young people understand health and to make sense of where they think HIV sits in relation to the many other factors that impact on their health in a local context. So I guess I was questioning some of the assumptions that were built into the design of youth-focused HIV projects around HIV being a really important priority for young people, and I wanted to see whether that was in fact the case. I was also very interested in youth participation. Having worked on youth projects, I was a firm believer in youth participation, but also recognised that a lot of the projects I'd been involved in that would describe themselves as participatory weren't really. And so it was difficult to assess whether youth participation was having an impact on young people's health, and in particular on their ability to try and come up with strategies themselves of things that they could actually do to try and reduce their vulnerability to poor health. Okay, just a little brief word about Papua New Guinea, because I realise it's not a country that many of you would necessarily be familiar with. It's the eastern half of the big island that sits just north of Australia, sort of big parrot-shaped island, and it has the unfortunate distinction of having the highest HIV prevalence in Asia and the Pacific. But having said that, it's still considerably lower than, say, countries in sub-Saharan Africa, or particularly southern Africa, and that within Papua New Guinea there's considerable variability of prevalence across the country. So in the island provinces and a number of the coastal provinces, prevalence is actually very, very low. But in the capital city and around Lae, which is the big port city in Morobe province, and also the Highlands region, there are significant levels of HIV infection, and the Highlands, which is where I was working, account for 60% of new infections and have the highest prevalence outside of the capital city. I was interested particularly in young people because they were prioritised as a target population in the National HIV and AIDS strategy, and youth participation and community participation more generally was seen as a key strategy in the national response. So that sort of also shaped my interest in that area for this research project. The existing approaches to preventing HIV with Papua New Guinean youth are fairly traditional, I suppose you could say. There is still a very large emphasis on awareness raising, including, I'm sure to your frustration, I know I'm singing to the choir here, but there's still a considerable promotion of an ABC model despite all the flaws of such an approach. There is also a big emphasis on condom promotion and distribution, and encouraging young people to have increased seeking of healthcare, sort of improved health-seeking behaviour, particularly in relation to voluntary counselling and testing and the treatment of STIs. And as I said, there is a big emphasis on youth participation. So to do this research, I was working with 3 pre-existing youth groups, so there was nothing, this wasn't a randomly sampled group of young people that you might use for a quantitative study. It was 3 youth groups that already existed and that I had had contact with at various times through my previous work in the country. 2 of the groups of young people were volunteers with Save the Children in Papua New Guinea's Youth Outreach Project, and that project aims to prevent HIV through a peer education type of approach. And the third group of young people that I was working with were called the Kanaka Youth Group, and they're quite unusual in the context of Papua New Guinea in that they are a local grassroots sort of homegrown youth group who not attached to an NGO or a church, so that makes them quite unusual in PNG. And they're the group, sort of larger group on the top left of screen, and the 2 other groups of young people were the volunteers with Save the Children's Youth Outreach Project. Now, I've just seen a question from one of the people calling in today about what the prevalence is of HIV across Papua New Guinea. The national prevalence is just under 1%. The original modelling had estimated by now that it would be well over 6% nationally, but the modelling's been significantly revised. That initial modelling was based on data really from urban centres because there was so little outreach. Papua New Guinea is an extremely mountainous country where access to rural areas is very difficult, and there were very poor services at the time those original models were done. Now they think it's around about 0.95%, so it is considerably lower than many of the contexts that I know people calling in today are working in. In the highlands, there are pockets of much higher infection particularly around mines. There's a lot of gold, copper, nickel, all manner of mining, and there's increasingly gas natural gas. So there's a very large liquid natural gas project that seems to be sucking in people from all over the country, and there's a lot of concern how that will impact on HIV in the Highlands. To briefly outline the process that we went through, so it was very much based on the Wang approach to Photovoice. I ran a 1-week training workshop with each of those 3 different groups in the Highlands, and in that 1-week initial training there was both a focus on basic photography skills. So most of the young people I was working with were out of school and weren't in any form of cash employment or formal employment, and most of them had never had a camera before, and quite a few had never even used one. So we spent a lot of time on basic things like, how to not put your fingers over the lens and not chop people's heads off when you're taking pictures, and how to use the flash. But the bulk of that week was actually about ethical issues associated with photography and power and responsibility as photographers. So it was about things like how to ask permission of people to take their photograph in a context where literacy levels are very low. A written consent form from someone saying, yes, you can take my photograph would have been quite meaningless, I think. So we put a lot of emphasis on young people practicing with role plays, how to ask permission to take someone's photograph, how to explain what the project was about, how to respond to community members' inevitable questions. And then they went out and practiced in pairs or threes in the market and local areas to give each other feedback on how they'd gone and explaining to other people about the project. Then after that first initial training, I had 3 follow-up workshops about a month apart with each of the groups, where I would go through this complicated process of getting everyone's cameras back. I was using disposable cameras, so we had to get all the cameras back and then get them into the provincial capital to process the film, and then get the photos back to the participants. They would then go through the photographs and select which images they wanted to talk about, and they would discuss those in small groups, and then in the larger group, talking about why they'd taken the particular photographs that they had and why they were important to them, and what they thought some of the underlying issues were associated with the particular issue they were raising. This process, I was involved with the 3 different youth groups over around about a 10-month period. Mind you, I've still got contact with a number of the participants now, and this is quite a few years ago now. But the formal research project went over a period of 10 months. That was quite an intensive period for the first 6 months, and then a little bit of a gap in the middle, which was over the period of national elections in PNG, when it's not so easy to travel around the country. And then we all came back together again at the end, and I got some funding to bring all 3 youth groups together to meet each other and discuss the process and have a joint exhibition. I distributed well over 100 cameras, and from that got thousands of individual photographs developed. But the young people didn't speak about all the photographs they'd taken. They would select which ones they wanted to discuss in the workshops, and that was really the focus of the data for the research project. Collectively, we would analyse the themes that were emerging from their photographs, so they would do that themselves through that initial selection process, but also in the discussions that they had, which were usually in groups of 4 or 5 young people. And then a smaller number of photographs were selected in each of the sites, so around about 45 photographs in each of the 3 settings were selected for exhibition in the local community with their accompanying stories, which were written in both Tok Piksa, which is the lingua franca for Papua New Guinea, and in English, given that some of the decision makers that were coming were expatriates. And then, because I was interested not just in what they were taking photographs of, but in the process of participation and how that might or might not have been affecting them as we went along, I asked the youth to write stories about how they felt to be a photographer, how they felt to be involved in a research project at regular intervals as we went through the project. And that was to try and capture the experience of participation as it was happening, and that was something that perhaps hadn't been done very much before. In the literature, there's a couple of authors who've retrospectively tried to look at how people, how the process of participation may have impacted on the participants, but I was hoping to try and capture it as we went along. we brought everyone back together at the end, as I said, and we also produced a short film, and I'll show some clips of that, and I'll give you the link to the whole film later if you would like to pursue it. And that film really was to try and disseminate the findings of the project, primarily within Papua New Guinea actually, and with donor agencies and NGOs working in PNG. It's in a mixture of Tok Piksa and English. So hopefully this will be I realise I've gone very fast, and I apologise if anyone's really struggling with the English. But just going on to the findings, talking about young people's perspectives. So I was concerned that given this group was a fairly biased group, in that they were all volunteers on HIV prevention projects, that HIV might feature as a big priority in their life, but that was not the issue, not the case at all. It was not ranked as in their top 10 health priorities. The number one health issue of concern for all three of the groups was something that they would describe as the school fee problem, which is sort of Papua New Guinean shorthand for exclusion from education, but a whole range of things, whether that's based on inability to pay school fees, the lack of infrastructure in rural areas, the undervaluing of formal education by parents, the kind of exclusion of young women in particular from education. So it all gets summed up in this phrase, the school fee problem. And whilst development agencies tend to see this as an education sector problem, the young people saw it very much as a health problem, and they associated being out of school with increased levels of substance abuse, with earlier onset of sexual activity and unplanned pregnancies, and they did associate it with HIV. They also saw it as being associated with harassment by the police and poor opportunities to pursue the future that you might want. They also suggested that family relationships were a really big health issue to them, particularly sort of neglectful or harmful family relationships. And for the young women in the project, they identified sexual violence as being a high priority. I should highlight that the young men did not raise sexual violence as a priority issue. One thing to point out is that the critical thinking shown in the photographs and stories, and I'll show some of the participants' photos in a minute, really developed over time. That the first roll of film that the young people took and the photos that were developed tended to be perhaps a little bit more stereotypical or of the obvious issues, or it showed kids mucking about, which, you know, is fine. If you've never had a camera before, I can understand why you want to take most of your photos of your family and friends and not necessarily about a research project, but that shifted over time as they would look at the different images that they took, that their peers took. And I think that the young people were very realistic actually about the factors that limit their future possibilities and also increase their vulnerability to HIV. And they were quite frustrated and puzzled really that these don't seem to be a priority in projects that are funded from the outside, and that really the only avenue for, you know, the main focus of youth work in Papua New Guinea is really only around HIV. So there was a real disconnect both between project priorities and youth priorities in terms of the content, but also at the level. Now I realise that diagram's really difficult to read on a screen, but if you do want to chase it up for your own interest, you can do so with that AIDS Care article I've listed there on the screen. But what I wanted to highlight with this very kind of crude ecological diagram was that at the level of individual or peers, family, school or community, that most youth-focused programs in Papua New Guinea, even if they would describe themselves as peer education programs, focus on the individual. So they focus on an individual's unsafe sexual behaviour, an individual's life skills, for example, you know, negotiation skills. But the young people in this project saw the bulk of the important influences on their health as being at the family level or at community level. So things like the breakdown of really basic infrastructure and services in their community had a huge impact on their health. Or at the family level, issues like polygyny or gambling within the family was impacting on young people's health. And that these were things that weren't really being addressed in youth-focused programs. Just to show some examples of the types of pictures that the participants took. So here Florence has taken a photograph of her parents actually, who were cooking flour balls, which are these not very nice. Seeing they're seen as a tasty snack in PNG, but they were doing that to try and raise funds to pay for school fees, and Florence is highlighting how subsistence farmers find that school fee issue very difficult. Primary education and secondary education certainly is not free in Papua New Guinea, and that puts a real burden on subsistence farming families. Godfrey here has taken a photograph that's quite cleverly illustrating the issue of marijuana use without incriminating anyone, which was an important skill that the participants really developed over time. And he's highlighting both that marijuana use is a health issue, but that the reasons why young people are using marijuana is that it's, there's nothing else to do and that drugs are fun. He also is talking about why young people sell marijuana because there's so few opportunities to earn a living. The next photograph and story, I remember the first day I saw this photograph, and I still react to it the same way, I think, and it's a good illustration of the emotive impact of Photovoice, I think. Sexual violence is prevalent in PNG, and Alice here writes that it's considered as almost as a normal activity, and she's managed to take a photograph of something that perhaps would be considered unphotographable and still tell a story about a really important influence on young people's health in PNG. And she, when I have interviewed her as part of the project, she would also speak very eloquently about what it's like for young women in PNG constantly living in fear. Okay, so it's a really tricky, a huge public health issue, obviously, but I think it was well captured with Photovoice, which was something that perhaps I had concerns about prior to the project starting, that we wouldn't get this really important issue showing up. Just briefly to show that the participants also took a very broad view of health. Here, Lobo is showing a power pole that doesn't have any lights, and he's talking about some of the health and social outcomes that happen when there isn't adequate street lighting. And this young man was really quite an advocate. He sort of put a lot of pressure, I think, on the community leaders in that particular community to try and address the violence that was so prevalent there. And here Regina has taken a photograph of the dispensary at the district hospital where she lives, and this district has 90,000 people living in it, and this hospital is their primary source of health care. She is a volunteer with Save the Children's Youth Outreach Project, and a large part of what they've been funded to do is to try and increase young people seeking treatment for STIs, and she's really saying, well, there's all this pressure on young people to change their behaviour, but when they get to services and seek healthcare, the services just aren't there, and that's not young people's responsibility. And she really was advocating, well, how about behaviour change for, people working in health systems. And finally, I just wanted to include this photograph as well, because they took I've shown, I guess, a lot of problems in those preceding photographs, but the participants also took photographs of things that had a positive influence on their health and on their lives. And here Jeff, who you'll see in the film coming up, took a picture because he wanted to show Papua New Guinea and the world too, and I knew there'd be people from all over the place, so I thought I would put this one in the presentation. That it's a beautiful environment, and young people really connected very strongly to the environment and to the land, and that had a very strong positive influence on health and well-being. And he's right, the Highlands of PNG are one of the most beautiful places I've ever been. So the findings in terms of, that was sort of a quick tour through their findings in terms of young people's priorities, but in terms of the impacts on participants, it was possible to capture change associated with participation in the project. So the young people reported, and I could observe, an increase in confidence. They felt and they did have strengthened communication skills, expanded social networks, thinking perhaps differently about the future, and were emotionally engaged by the process. And on occasion, dialogue in that Freudian sense of co-construction of new knowledge was achieved. It didn't happen all the time. There were some areas where the participants amongst themselves, or the participants and I, were not able to co-construct a new understanding of a particular issue, and I think gender was a really big challenge there. But there were other issues where we were really able to genuinely bring, our various different understandings of an issue together to try and achieve a new level of understanding. But I think you must be sick of this Australian accent jabbering at you, and so I thought, instead of me talking about other people's lives, when I've got footage of the participants themselves talking about the impact of the project, I've just play some clips to illustrate these points. So the participants did report that the involvement in the project had increased their confidence, and here we'll see Mike talking about that now.
I see in myself, it helped me to talk and stay at the front of people and talk and give me more confidence that I see in myself that I fit, I can do what it's come, I can do it. It's nothing impossible. And as an illustration of Mike's changed confidence, when I first met him, he would only speak to me in Tok Pidgin, and he was 17 when I first met him, and he stood up and he introduced himself hiding his face behind his hand, and by the end of the project he was quite insistent he wanted to speak in English, which takes a lot of confidence, and was making speeches at the opening of one of the exhibitions. Okay, just on the next point that the participants raised, was around strength in communication skills. So here Alison's talking about, well, if we had a good chance to hear from one each another, sometimes, I don't agree with what other people say, but she felt that she'd learnt to listen. And then Susan, who is speaking in the video on the next screen, she also spoke about the increase in her communication skills.
Na mi tok so time mi tok mi pili mo se mi proud lo sana lo public na making this la tok because I'm one of the young women. I have to speak for my rights.
And she did so. Susan spoke on behalf of the participants at a International Women's Day event, and that was something that hadn't happened before in Goroka with the International Women's Day celebrations. They usually didn't call on young women to speak for themselves. It was usually older women dominating that process. The participants also spoke about having expanded social networks, and that was particularly through the exhibitions where there was a chance to engage with decision makers and community leaders about the issues that they raised in their photographs. And Augustine on the next slide will talk about that.
After the exhibition, the invited guests, they actually knew what they never taught or learned their own people, that we came up to tell them.
And I like the way he puts that, but if he invited guests, and there he's referring to community leaders, that we came up to tell them, and that's not something that these young people had experienced before. And then another issue that emerged through people's participation in the project was that the young people described thinking about the future and their own future differently than they had prior to involvement in the project. So I'll let Michael and Jeff, this is a slightly longer clip, this next one, two of the participants talk about that.
Sore milugum samlang gudla sadi osem bibo mini saulok simpoto disagay na mini saulong one toto one of friends in the vim online na lugum bagra pong gudla sadi mini saulugum mi film osem time start mi film pred na disagay na same tua. So now mi filo sem sasari bigla sadi mi big plan mastru mi lugu planti friends now mi kama sem disagay man now mi stop osem mi filo osem mi big plan dreamano sem you must make muy gona senes meria blo mi na community blo
mi film osem mi line nula something serious osem mi time go out on the camera blo mi nambot mis name all something nam lugu all something all man na one all paying respect lo mi osem all making osem mi film osem mi bigla mangina min sa tuktok lo public to osem exhibition lo Photovoice ta solem make me osem mi feel confident lo sana lo public na bot na tuktok osem min afraid gen lo any something now.
So again, Jeff, the last participant who spoke there, who was the young man who took the photograph of the Wagi Valley, which to show you all what a beautiful environment he lives in. He was also one of the youngest participants in the group, and really talked about a very different way of thinking about his future than he'd had prior to the project starting. The methodology also engages people on an emotional level. So whether it's talking about sexual violence and seeing a photograph like the one that Alice took that you saw before, or talking about gossip and young people being able to illustrate that really creatively through photography, it did connect in an emotional way with the audience. So here Godfrey is talking about some of the people crowding around were sad because they have their own children, and these were community leaders and politicians, and they would ask him a lot of questions. Or women's group leaders, the mamas, would say, we hear about these things but we never see it, particularly in relation to drug use. And that Godfrey then felt proud because he could explain to them because it was his own lived experience. I think that the opportunity for self-reflection and self-representation really engage young people on an ongoing basis. So quickly through the last points, Photovoice, because it provides, you produce photographs, if you use participatory analysis tools like problem trees or causal diagrams, those artefacts are a mediating tool for conversation between young people and community leaders. So that photograph shows Mike talking to one of the women's group leaders. And the photograph itself really provides evidence of young people's expertise in their own lives and gives them a lot of credibility. But it also overcomes all sorts of eye contact taboos. So it's much easier to have a conversation and for young people to initiate, discussion when they can look at the photograph and talk to it almost, rather than having to directly make eye contact, which is very difficult culturally in that part of PNG. There are challenges, however, and these are just a few associated with visual methods. So there are particular ethical issues associated with visual and participatory methods, some of which have been raised by Carolyn Wang and her colleagues, but a lot of which, for me, emerged through the research project, and I can perhaps answer questions about that when we get to the discussion. Sometimes I think I was worried about whether there would be an over-representation of sensational things like inter-clan fighting and the sort of more spectacular violence rather than the day-to-day grind of people's life. But actually the young people were really creative about how they took photographs of the things that they thought were important, and the unphotographable did turn up in this picture, in this project. So I think we were able to overcome that challenge. I think that how photography and video is being used in communities is changing, and right at the time I was doing data collection there was introduction of mobile phone reception. There'd been no phone reception up until that time. And in the years since the data collection, I know there's been an explosion of young people having mobile phones, some of which have cameras, and I think that's going to change how people engage with photography and video, and I don't think our understanding around ethics, for example, are keeping up with that at all. There are definitely challenges around time. It's not a quick process if you want to engage with people in any depth over the work that they're producing, and it can be difficult thinking about how you analyse visual data. But I do think the method is very powerful, and I suspect that the findings of this particular project perhaps imply that, it can facilitating self-reflection and self-representation might be a new role for health promotion programs, and perhaps programs should prioritise communication skills as much as they currently do technical skills, and seeing research as an opportunity for transformative communication. I'll leave it there because I have gone over time, but just to say that there's some references I suggest that will go up online, and to thank in particular the participants in the project, Save the Children, the district administrations, and particular individuals who really supported the project.
So we have one question from Anna Forbes who says, did you get any pushback from parents about publicly highlighting issues that may be considered socially taboo to discuss publicly? And so was there any sort of negative concerns at a community level?
Yeah, and that's a really good question because I was concerned about that. There wasn't such pushback from parents, but there was some resistance from politicians, like bureaucrats and politicians. So one of the young women took a photograph that was really quite critical of police and law enforcement in her community, and I think it was most people in the community would have entirely agreed, but obviously the district commander was not so impressed, and I was really concerned that there might be negative ramifications for that community or for that young woman, which thankfully didn't happen to my knowledge, and I have spent time there since, so I feel fairly confident that was the case. But he was kind of crossed that his police had been negatively presented, but actually also saw it as you know, when in conversation with him, as an opportunity to kind of vent about all the structural problems he faces. So this is a district level police commander. You know, he's got problems at provincial level, at national level, you know, underfunded, underpaid staff, and so on. So I think, you know, the pushback was really more about him wanting to express the challenges that he faced. From discussion around sexual violence, that particular photograph that of Alice's that I showed stimulated an awful lot of discussion, and some of the, again, politicians particularly were like, oh, we shouldn't be talking about this, but actually the young people didn't have to argue about that. You'd hear the women's leaders in the same space at the community exhibition really resisting people saying we shouldn't be talking about this, and saying, well, we should be talking about it, and you should be doing something about it, and so on. So I think that people were, I don't think there was negative repercussions or harms to the young people because of that. I think there were some real challenges for them around other issues, but not particularly around that issue.
Great. Thank you. Actually, right after you began discussing that, another colleague from Myanmar asked specifically about taking photos of public buildings or security issues. And so I think you've addressed that. There is another question here. It says you mentioned having some problems with, let's see, let me find. You talked about having some gender issues in terms of communication, and she's interested in if you could elaborate on that a bit, and was wondering whether or not you ever held smaller group discussions that were single sex, and then mixed discussions, and if you had any reflections on that.
Yeah, look, I think I work in a centre for gender and women's health, and, you know, obviously being female, I feel very strongly, and the, you know, young women face really particular challenges to their health in PNG. It was an ongoing issue through the project. In the two youth groups where we had mixed young men and young women participating, the young women would. So I'd always break them into single-sex groups for the initial discussion and selection of their photographs and the initial analysis around the issues that they were raising, but then would try to bring them, the young men and young women, back together in plenary at the end so that the young women would have an opportunity to raise their issues to the young men and have everybody discuss them. And, you know, certainly the young men would listen, but the existing power dynamics within the group would come to play at this stage, and they would certainly raise, you know, particular issues around, say, sexual violence, and the young men would listen to them, but when the young men would disagree, it was very hard for the young women to have the confidence to counter that, and they're not used to doing that. And the other thing that tended to happen was, you know, during the day-long process, I would just observe that at around about, you know, 10:30 in the morning, the women would just slowly disappear, and you'd realise they were going out to the tea room and they were making cups of tea for everyone, and that no one would ask them to do that, but they would just see that as their role, and the men would assume they were doing that, and that hampered their ability to participate in the discussions. We also had more, we didn't have very much dropout in the project overall at all, but there was certainly a higher rate of dropout amongst young women than young men, and it's just very difficult for them to sustain this kind of engagement when they're expected by parents to be doing a whole range of other, you know, have a whole lot of other responsibilities around the home and in the gardens. So it was more difficult for them to sustain involvement over the 10 months than it was for young men.
Right. So we have another question that said, could you say just a bit about how one goes about analyzing the visual data and what is the participant role in the process? Yeah.
This is something I'm still grappling with a little bit myself. I'm not an anthropologist, so I haven't been trained in visual anthropology or the kind of semiotic analysis that a visual anthropologist might use on the photographs. So it was more through me talking to the participants about their photographs and why they might have taken the type of image that they did, and that I analysed those conversations. So again, I went back to text. I'm still struggling with this as someone who really like visual methodology, and I think there's a lot of potential, but I feel ill-equipped to do that sort of visual analysis of a photograph without the accompanying story from the participants. The participants were very involved in analysing the issues. So if, for example, second marriage or polygamy, men taking second and third and fourth and however many more wives, came up as an issue, then they would do an analysis of that in terms of exploring what were the underlying reasons why they thought this was increasing in their community, what were the consequences of this for young people's health. But that was based on the issue raised in the photograph rather than analysing the photograph itself. So I probably am not the right person to answer on that one.
An interesting question from a colleague named Nora, who basically says, "Are you aware of any groups or any efforts to try to use this methodology using like local, where the rather than youth or CBOs or whatever, it's actually local authorities or local decision makers who are asked to and engaged to take pictures like we saw the one."
Yeah.
Pharmacy
that's right. There are examples of that, and there are actually quite a few from the US. So Wang's group, or the Michigan group, has done this in Flint, where unfortunately they've mainly published about the youth side of that, but they did a Photovoice project with both young people and policymakers and decision makers, and asked both of them to take photographs of what was important in their communities, and then brought those two perspectives together. I think that would be a fantastic approach to use. The challenge for me, I guess, in Papua New Guinea was getting sustained engagement of community leaders. I think that would have been really tough over the period of time that I was working with the young people. It was a little bit distinct from my research questions as well. But as a principle, it's what we'd like to do in Philippines around disability. So I think it's a great idea, and it has been done. If you follow up the Flint work in Wang and other colleagues, and if that person wants to email me, I'm very happy to send on some references.
Great. A colleague, Carolyn Allen, was interested in, do you have any reflections about how you think the introduction of mobile phones and some of the new social media technologies is going to affect photo voice approaches, and are there groups now using mobile phones, for example, as the medium as opposed to disposable cameras? And
look, I think there is distinct, there's a lot of people doing participatory video, and I think that's got huge strength and certainly an even greater depth to the language or vocabulary that people can have to express their life world. The challenge around that is having someone with the technicals, and it's not that challenging now. It's getting increasingly easy, in fact, to edit material on a laptop in the field or on phones. You can even do very basic editing functions for video if you've got an expensive phone. And so I think people will increasingly shift to participatory video. There are some people doing work with mobile phones as an intervention. There's actually a guy based in Australia, an Australian journalist who's done a lot of training in settings around the world with young people on mobile journalism, or Mojo, they call it. And his name's Ivo Burren, and he's written about that from the perspective of the journalist, so not so much as a health researcher. He's now interested we're looking at trying to develop a project to look at the health impacts of that type of an approach, where young people are trained to, do the editing themselves, to produce these small films themselves and distribute them. And I think that is probably the direction that things will head in. Having said that, I still think there is a place for still photography and community exhibitions, because one of the most powerful aspects of the Photovoice method is the exhibition, and it may be harder to achieve that with video. Not impossible, but perhaps a little more challenging.
Okay, just at the end, is there anyone who's brave enough to actually ask a question as opposed to send one by chat? Do we have anyone who'd like to ask Cathy something directly? Okay, we have a I I unfortunately just hit something where I've lost the list of chat questions. Liz, do you still see them? Could you?
I can still see them, Laurie, actually.
Oh, okay. Why don't you pick one out that you'd like to respond?
Okay. So someone has asked about challenges with Wang's suggested approach to facilitating group discussion using that showed mnemonic, the what do you see, what's happening, how does it relate to our lives, and so on. Where we found that was a good way of facilitating the group discussions the first time round, but then the participants actually, as they got into it and sort of were familiar with what was expected of them in terms of discussing the photographs, they found it a little bit constraining and restricted the natural free-flowing discussion that they were having about their photographs. So in the end, I didn't sort of get them to answer those specific questions. They would just have a discussion about, what the underlying issues were raised by that photograph, why, it related to their lives, what could they do about it, and that was in part how they would come up with ideas for some small activities that they could do around the Photovoice exercise. So that was that question. Someone has asked if they can email me. Absolutely. Then how to use Photovoice as part of an evaluation of an intervention. There are quite a few papers out there actually where Photovoice has been used in that way, and sometimes it's people taking kind of before and after photographs of things that have changed in their community. Others have used it as a way of expressing, so they might not take a photo of a before and after thing like here's a water supply and here's no water supply before the project, but to express the impact on their lives, so things that might have been made easier like water collection, taking Photovoice that way. So, but that process tends to be done fairly quickly rather than in a sustained way over time where you're also trying to perhaps have a positive impact on the participants as you go along. Someone asked earlier on about... Yeah, sorry.
No, we're actually sort of at time.
Yeah, sure.
You can... let me just close it here. And people who didn't get their question asked, I think could probably email you. And do you want to tell folks what your email is?
Yeah, so it's c.vaughan, VAUGHAN, at unimelb, unimelb.edu.au, and it's on the first slide, which I imagine will go up on the website. And on various, some people will see CM VAUG. It gets to the same place, don't worry. Either of those email addresses are okay.
Great. So just to let people know what happens next is if we will take this video and make it into a video, take the presentation, make it into a video, and then post it on the Strive website. You can reach the Strive website at strive.lshtm, which stands for the London School of Hygiene and Tropical Medicine, and then it's .ac.uk. And what you'll see is all of the past learning labs are available so that you can watch them, and we really encourage people, especially people that had a hard time hearing the entire thing, to potentially bring a group of people together in their setting, watch the video, and then discuss its application locally. We'll also try to get from Cathy some of the resources that may be publicly available about Photovoice and put them in the resource section of the Strive website. So check back in about 2 weeks, and we should have a page that will have information for those who would like to get started or refine their processes with this technique. So the final thing is I ask when you hang up, you will see a small little questionnaire. It takes all of 3 minutes to fill out, but it really does help us track interest in different topics and how well we're doing with the learning labs. So we encourage you to please take the time to fill this out. And anyone who participated today, we will add you to the list to get notices about future learning labs. So I want to thank Cathy and the women who participated, women and men who participated in her research that she shared with us, and we'll close out this current learning lab. Thank you very much.